Hello, my name is Neil. I'm with Ambu. Today we're going to talk about a brief in-service regarding our infant SPUR resuscitators. Just like our adult and our pediatrics, they are color-coded. We have green for the color code indicating for infant, like we have the yellow indicating pediatric and the blue indicating adult. Just like on the adult and the pediatrics, we have two basic configurations rather than three. Everything that we have offer or have available is built off of these two configurations. We have our 10-inch tube reservoir version here, which is our most popular version, and then we have our bag reservoir version here. So moving into the resuscitator, when you pull it off the shelf, you'll just remove this quick guard band for the packaging. And again, you'll see the very big patch of green indicating the infant resuscitator. Just like our adults and our pediatric bags, you will have the same perforation and tamper-proof area there that you will remove. If that is not there when you encounter the resuscitator, you should be aware of that, as there could be parts missing. It could have been used on another patient, so we do not recommend you using that resuscitator if you come across one that way. Pulling the resuscitator out, just like on our pediatric and our adults, you will see that the mask is going to be attached. We're going to take that and set that aside for just a few minutes. We're going to start just like we do with the other bags at the very back. We'll start with our 10-inch tube reservoir. This tube reservoir is designed to give blow-by, where with your traditional infant resuscitators, you will need to disconnect your O2 tubing to use for blow-by, or you will need a separate oxygen tubing for blow-by. You can incorporate ours into blow-by by just turning on the oxygen. It will fill the compression unit and come back out, and you can direct it that way. Just like our other resuscitators, we have a green oxygen inlet here. That is for your flow meters or hooking up to your oxygen tanks. Green is the universal color for oxygen, so we have color-coded that green to match. Moving forward, we have our 220 milliliter compression unit. With our infant compression units, these are very, very thin-walled, very lightweight, and going to give you very, very good feel and lung compliance compared to your other infant resuscitators on the market. Your average stroke volume with our infant resuscitator is around 150 mLs per compression. As we move forward, just like on our pediatric version, we have our 40 centimeter pop-off. It will come disengaged out of the package. Just flip that up and it'll snap into position, and then to disengage it, it just pops right back down. Just like our pediatric and our adult versions, we have our medication port here. This is for delivering any type of cardiac care drug or infant drug through the resuscitator. Again, like the pediatric and the adult, you can also use this for ET CO2 monitoring. As we talk about more familiarities with our pediatric, our infant also has our manometer port here with the tethered adapter. Just like we mentioned on our pediatric bags, our infant manometer port is following the international ISO standards for respiratory care. So our manometer port here is not the same size as your oxygen inlet port. You will need to use our adapter, flip that around, and connect that so that you can hook your O2 tubing that would go up to your high-powered gauge or wall-mounted manometer. For some of you folks out there that do not have a high-powered gauge manometer, we also offer our disposable manometer here. This manometer just screws on just like this, so you can ventilate. It will also rotate around in different positions, so depending on where you are at the bedside, you can always see that monitoring. Okay, remove that for now. Just like in our adult and pediatric versions, our PEEP valve placement is in the same place. Just take your standard Ambu PEEP valve, push and twist, just like on the other configurations, and that will hold that PEEP valve on there nice and secure so you can administer care. Moving to our mask, just like our adult and pediatrics, we have that same tearaway dust cover. Dust cover is there so that if you are to drop this mask after pulling the bag out of the package and it becomes soiled or is contaminated, that dust cover protects the mask so you can continue to use it. Just pull that off just like that. Just like our other masks on the market, we have that defined shelf. Again, it allows you to grip that mask very easily and very well so that you can get a good grip and seal around that patient's face. As well, just like our other ones, we have that defined nose bridge. So again, it gives you a good seal around the bridge of the nose. With our infant resuscitators, just like on the pediatric and adult, it's going to connect right there, and it will rotate 360 degrees in all directions. So depending on where you're at, you can administer care at the bedside. And with that, that concludes my in-service today. Thank you for watching.